Good afternoon, everyone. Thank you so much for joining us on this beautiful Wednesday. Welcome to University of Vermont's Healthcare Management and Leadership Informational Webinar. We have a lot to get through today, and we have some special guests with us and joining us in studio and live via webcam as well. So let's get right into it because we always want to be mindful of everyone's time, and we've got a jam-packed agenda for today. My name is Nicole Willier-Fenton. I work in the Continuing and Distance Education Department as our Content Marketing Manager. We'll go through brief introductions. We'll talk about healthcare management leadership seminar topics, and there are 5 separate days in which the seminars take place, and each one has a little bit of a different spin, but how do they all connect? And Kathleen Hamilton, who's been developing the program from the beginning, will walk us through some of those objectives of the overall program. Why strategic planning is important in any organization, but in the incredibly changing healthcare industry, how important strategic planning is to the healthcare industry today. Student perspectives. We have a wonderful former student joining us, Kathleen Merrick. Hello. And we'll hear from Kathleen as well and other perspectives of students. And then, of course, we'll get into some of those course logistics to make sure that you are ready to register for this wonderful course. So joining me today, we're so thankful to have Kathleen Hamilton with us today. She has been integral in the conception and the logistics and the implementation of our healthcare management and leadership seminar right from the beginning. And she works at Blue Cross and Blue Shield as a VP of Consumer Services and Planning and an adjunct professor here at the University of Vermont. Welcome, Kathleen.
Thank you so much.
Catherine. Thank you so much for joining us. And
My
we
pleasure.
also have Kathleen Merrick, as I mentioned, via webcam. Kathleen is a recent graduate from the program, and Catherine and I were excited to see you as well and to hear your perspective. Before jumping into University of Vermont Medical Center, Kathleen had a wellness practice in New York State for nearly 17 years before kind of changing directions, and we'll hear from her as to how this course enabled her to do that. So we're really looking forward to your perspective today. So I want to toss it back over to you, Catherine. So let's talk about this program is an intensive 5 different days, they're on Fridays, seminars that dive into the healthcare system, how you can be effective in the healthcare system today. What are really the objectives and the goals for students in this program?
Sure. Well, thank you for the opportunity. This is a really unique program in terms of what it offers healthcare leaders. First, it offers leaders an opportunity to connect with one another and to network, and to do that in a quality way. So we're not just talking about one day, but to create some continuity there. Second, I think this program is really for people who want to take their career to the next level, but maybe aren't ready, or maybe they've already taken the step of doing a graduate program. But this gives you very pragmatic tools, but also with, with us really with something you can bring back to your employer and then demonstrate to them and use on a job interview. We all know how competitive healthcare is today. On the one hand, there are great jobs, but those jobs are often sought after by candidates so that have advanced degrees. So, for example, you may have a decade of experience working in a direct role in a clinical setting, and you may want to take that to the next level by being a leader or getting into healthcare management. This is a really excellent start of that journey for you. It's also, I've seen it very helpful for students who want to make a career change. So maybe they're working on the research end of healthcare today, and in the future, they want to move into strategy or project management.
And one of the things that I think is so key that you've mentioned to me as well is the caliber of the instructors that are leading these 5 different seminars. These are experts in the industry that are working in the industry every single day. So that knowledge is being brought back to the students.
Exactly. So we are not talking about just an academic program. We're talking about a real world experience. And that's what I love about teaching in this program, is that it brings in really strong leaders who learn from one another, but that are also seasoned enough that they know they're more focused in terms of what they want to take away from the program. And then the instructors themselves are bringing tremendous experience from the real world. So it's not theoretical. When you leave this program in each of the seminars with practical tools you can take back to your workplace, try, and then come back and have a support group on which to share that information, test it out. I've done a lot of networking with the students who've been in the program, either networking on career advice or even help with connecting with jobs.
Really great. I think the resources that go beyond just the resources that you're gaining in the program is so valuable to students. And we have a slide up here, which I think is really interesting. We won't touch on all of the different types of positions, but I think it gives you an idea of the breadth of different positions and different career opportunities for people as exploring this program or as a result of the program that could be an opportunity. So we're going to just a quick overview of the different topics. As I mentioned, there's 5 different days, and we'll go over the actual dates here in a few minutes on another slide. But we start with project management, and then we move into healthcare management and strategy, change management, data-driven decision making, and leading and developing employees. And I'll have Catherine go over a little bit more about that. But I just wanted to also just put up a brief summary of some of the outcomes of each of them. And you're seeing things, best practices and hands-on application and developing tools and strategies and planning a change process, practical exercises, discussing challenges that leaders have, how to coach and manage employees. What I think this is echoing is what Catherine was saying is the hands-on practical application that you can get out of these, each one of these seminars is really relevant to the healthcare industry today. Would you say that's true?
Yes, absolutely. And one of the things I really value about this program is that, anyone can develop a strategy, right? We can all have a beautiful plan, but implementing that strategy is where the rubber meets the road. And this program offers both. So it gives you a toolkit around how to develop goals, a balanced scorecard, some other techniques for strategy development, but also implementation.
Yeah.
And resource management, human resource management, how to work through those people issues. And that's a really powerful perspective.
An outcome. And I have a slide which I think will speak to that in a little bit. One of our former students talked about, as a result, one of the outcomes of the program for him was knowing how to staff up and to level up to take it to the next level. So there's some real valuable information. Kathleen, I want to turn to you. And so if your mic's not on, let's turn that microphone on for a moment.
I think I'm on. Can you hear me?
And I'd love to hear from you. You and I've talked a lot, and thank you so much for being with us and being an advocate for this program. Some of the things that we've been talking about with Catherine as well, what has been your perspective as to some of the outcomes that you've been able to utilize as a result of this program?
Okay, great. Can you hear me okay?
Yeah, we can.
Okay, good. So I can't say enough about the program in general because it gave me the leaping off to like 5 different courses. Each day was so condensed with the amount of material that was provided via the email, what was given to us in the material to take home, but then just everything that was covered that day. There was plenty of time for conversations and real life situations from people that were sitting around our tables. Even when we broke into smaller work groups, we got additional information out of that. I found that I loved the data-driven decision making, and I thought that was going to be my worst day. I was going to be like, okay, I'm not really involved in that, but that's going to be boring. But it was actually the most content, and I changed how now I bring things into meetings. I go in with my data now because I used to go in with like the touchy-feely, like this just doesn't feel right or something's just not, but that just takes way too long. So now I've completely changed how I go into meetings and how I present things, and it's all with data. And then you can add the touchy-feely in healthcare and the patient perspective, but I was never thinking about it. It like flipped something for me on one of the courses that I thought was going to be something that wasn't going to be interesting to me. So every single Friday was an adventure.
That's so great. And we're going to come back to you on some more of that perspective in just a moment. Thank you so much for that.
Yep.
Catherine, let's turn back to strategy and why it's so important to develop a plan. I don't know if there's another industry that changes as often as healthcare. And so bless you for trying to keep up with this. But how can you guide students in the work that you're doing in these seminars to develop and also help implement a strategy in healthcare? And why is that so important?
Well, thank you. The only constant in healthcare is change, and anyone working in healthcare recognizes that. I loved Kathleen's comment about the data because data, this industry is so hungry for data, and the idea that there's a lot of it, but making best use of that data, both to understand the drivers of your problem, whether it's a health policy problem you're dealing with, whether it's a service operations management or just a practice management challenge, whether it's a research challenge, how you position your data and then make a compelling case for why change is important. I've spent 25 years in healthcare, and I would say that the last decade has been really about expanding access to care, access to insurance. We've seen the Affordable Care Act come, it's still with us. Um, I think the next decade is going to be about payment reform and organization of the delivery system into accountable care organizations, and then hopefully reorganizing ourselves around patients, putting patients into the middle. And I think one of the reasons I feel strategic planning is so critical is to bring patient information, consumer information into how we think about resources. I'm not sure the system has really been designed with the patient in mind historically. And so many people in this leadership program have a lot of hands-on experience working with people. I also think one of the things that gets overlooked in healthcare is those who are delivering the care and their experience. So as I think about strategic planning, I look at it obviously from the financial perspective. So I use a balanced scorecard approach, which is a helpful way to make sure you're looking at all of the perspectives. So often we follow the dollars in healthcare, and this is a $3 trillion industry. And we often talk about the costs of our system, the costs of care. But there's also a perspective on the consumer and the customer, the people purchasing the care. The third perspective is the organizational perspective. So that is all the key processes that drive the results that we want to achieve in healthcare, whether that's patient outcomes or satisfaction with care, or even the cost of care. There are processes. So whether it's your medical record system that's really capturing all this data that we're so hungry for in healthcare, or whether it's the way that you've organized your resources on the floor of a hospital, or the way you've organized your supply of medical equipment or pharmaceuticals. So thinking about the organizational and process flows. And then at the foundation of all of this is the people delivering. And I know we're involved in a transformation, a technology transformation that involves digital technology, digital assistance for
digital
everything.
Digital
But there's a
webinars.
real people perspective here. And as we, I am not a robot. I don't know about you.
No.
I'm asked that question all the time. And we as leaders are being asked to bring more technologies into the world that we do. But I do believe that at the end of the day, the human touch in healthcare is really critical in how we treat our people, how we give them the tools and technology, and continue to have that high touch experience so that we bring the compassion to healthcare that we know is needed. And again, focusing on the patient, I think, is what ultimately is going to not only improve the outcomes of healthcare, but also the costs.
Yeah, and the experience for
And
everyone.
so, right,
Yeah,
so that
absolutely.
leaders that can understand healthcare from that balanced perspective are going to be successful in their roles. So in my piece, I give some pragmatic tools. We do a 101 on what's broken about healthcare. That could probably take up all 5 sessions. We talk about international systems and try to get a perspective on what we might learn from other countries. And then we get into some practical applications of developing scorecards so that you can go home and begin creating a measurement system in your own organization on trying to improve the work that you do. And that will, I think, that can bring value immediately to your organizations. I strongly encourage leaders to tailor their style to the organization they're in. So if you're working in a $1 billion company with 500 employees, as I am, your methods of planning are going to be one way. I'm also in a nonprofit organization, and that's going to bring a certain style of leadership. Whereas if you're working for a pharmaceutical company that's a for-profit, maybe you're bringing a different style. And if you're in a small practice with 5 employees or in a larger hospital, it's going to vary the tools you bring. So I encourage students to vary those techniques and styles as they bring their leadership.
And I know that
skills.
Kathleen has mentioned this as well, and I've heard from other students that one of the things that I think is so valuable to folks too is that you also try to encourage that life balance too. And you incorporate a
Yes.
little fun, I think,
We
into,
do. We
and a little
do.
yoga maybe.
I have to
Yeah.
say that I do believe that there's a big relationship between wellness and leadership effectiveness. And I consider myself a wellness leader. And I think people working in healthcare today also acknowledge that. So we do. This is being able to step outside of your box a little bit in a free space. I always say that what happens in our seminars stays in our seminars, although we do welcome your feedback and we use your feedback to improve the program. And I've seen it evolve in a very positive way from the feedback we've received, not only from students, but also from employers in terms of what they're looking for. But within that safe space, we do have fun. These are on a Friday. Your time is valuable. People are traveling long distances to arrive there. And each of the lecturers appreciates that, the value of the time. So we do take a little time. The settings are very positive work environments. We do take breaks. We did take yoga breaks during mine.
Yeah.
They're not required.
Right, right. You
can,
don't have to, of course, yes.
but just taking the time, because acknowledging that this is an opportunity also to unplug a little bit from your day to day. Step
Have
back.
the time to think.
Yes,
Yeah,
and this
absolutely.
isn't just
So
a
key.
2-hour webinar where we're, or even a half-hour webinar where we're cramming
trying to
in.
put so much into it. Yep.
So often we're drinking from a fire hose at work, and it is stepping back a little bit and just allowing that environment for learning.
Yeah, which has been really positive for people. Absolutely. Thank you so much for that perspective. The other thing I just wanted to mention too, as I'm seeing some of the folks here in the webinar with us, if you have questions, please use the chat box as to where we were saying hello and where you were from. If there's questions of Kathleen or of Catherine or specifically about the program, please, I'm monitoring that and I will keep an eye as well as to if you have any questions throughout, and we'll try to address those throughout and give time at the end too. Kind of seconding what we've heard too, I wanted to just share a few different slides here that talk from some student perspectives. They talk about what they really the value that they got out of this program, and I think one of the reoccurring themes is outcome, is tangible, is actionable items that they have received from each of those seminars. We've had students say that by the end of the day Friday, they went in on Monday and tested, and Catherine made mention of that, testing some ideas and some theories. And so in the world that we live in, it's really helpful, I think, to have that opportunity, that space to learn some different approaches, test it out, and then come back and get feedback on that too. Kathleen, I want to come back to you for a moment with that idea. What was it like for you? Were you able to, and I know you were in a little bit of a kind of a transition mode at that time, but how do you feel that you're utilizing in your current position some of the work that you did in the seminar program?
Sure. First, I also just want to say too that meeting these 5 leaders in our area was a great way to kind of spend the day with someone. You know, a lot of times you're in a bigger meeting and you say, oh gosh, if I could just pick her brain for the whole day. That is one of the things I really loved, because you could have that content of being with a really, wise leader for an entire day. So that was huge. How I took these things back in my role is because I'm also preparing to get ready to take a master's program. And I just don't know which way I want to go. So this gave me all of the kind of pros and cons about if am I going to go into healthcare master's program, am I going to go into a project management more program or certificate program. It just gave me all of the content that I need to really sit down after this certificate program was over and make my decision. It was like I got to spend the day with some great people in each area, in each silo of this whole program. It was fantastic.
That's so great. Thank you so much for that perspective. And we are encouraged that you want to continue down the lifelong learning path. And so folks that are considering this course as well in these seminars, you'll see some of the logistic information up on the slide now. And we're trying to have this information session well in advance of that March start date to give you some time to process, consider, speak with your employer and seeing if this is a right fit, because it's also 5 Fridays, and so there's a bit of planning that needs to go if you aren't in the Burlington area. And they do take place in the Burlington area on the Fridays that we've listed there. You can see those Fridays, fairly consecutive Fridays. The cost is $1,995. There are discounts, and you'll see a listing there, and many of our UVM affiliates are also receive discounts as well. Easy opportunity to register, just jumping on our website at learn.uvm.edu. And you'll also find, again, as we have an opportunity to answer any questions today, you'll also find on our website there's a chat function that comes up fairly early on our website. So if you're considering something and you want to just have a quick conversation with one of our enrollment coaches, please use that opportunity to answer any additional questions. And also, if there's a specific question for Catherine or one of our other instructors or one of our students, we would be more than happy to connect you to make that connection and for you to have that opportunity to learn a little bit more if there's a specific area that you're looking for. So I'm not seeing any questions from our folks today. I know we have Heidi and we have Jeff and we have Kirk joining us. If there's any specific questions about the program, please do share them. I'll keep an eye out for that as well. But I wanted to maybe toss back to Kathleen again. What I'm wondering is, why would you recommend this program? And I think you made a really good point that you're considering your master's and some different avenues. There are a lot of different management and leadership opportunities for people to continue their learning out there today. And so what maybe makes this program in particular so valuable for some of those prospective students that they're considering this program? In your opinion, Kathleen, why would you recommend this?
Well, it also shows to your current group, wherever you're working, that you're interested in advancing yourself. And because I had to make arrangements for each Friday, and a couple of those were a little tight, but my team stepped up and said, no, I'm gonna make sure that's covered. So it shows that you're taking initiative to gain more information. So that's one thing. The other part of it is it's time to learn something new. Sometimes you get stuck in a role where you've been working for so long and you want to make a leap, but you don't know which direction to go into. This was like, the whole coloring box of colors of different areas that you can go into. So that was really helpful. And getting away from your job, I think it's so important to continue learning. The venue was wonderful. I just put that up. There was, really creature comforts of getting up and doing some stretching and then also walking around. You could still connect back to the office if you needed to. But I found that my group really kind of stayed close, like, let's just keep this day for learning, for what we need. And I really valued that.
That's great. Thank you so much for that perspective. I'm going to come back to Catherine for a moment. You must get this question a lot too. Well, why that program? There's a variety of different things. And in healthcare, there's so many different segments that you could probably explore a little bit more. Why do you think it's so key that this program pulls in 5 different topics in healthcare and bundles it all into one, and that opportunity for that student based on this program curriculum?
One of the things I like most about this program is that, one, you get those 5 diverse perspectives, but you get them in enough depth for one day.
Yeah.
Like Kathleen was saying, you really get to know the lecturer in a way that you might not. We've all seen conferences or one-day events that are just sort of one-hit wonders where you go, maybe you make some great contacts, you get great information, and you go back, but there's no follow-up. So the idea that we've pieced this together over 5 weeks, as well as sort of, it gives you the depth, but it also gives you breadth. So as Kathleen was pointing out, it's a great opportunity for someone who's thinking about exploring perhaps a master's degree in one of these areas. Not really sure, maybe it's human resources management, maybe it's public health, maybe it's more financial management. And it gives you enough depth within that one day so that you can step back and then decide, maybe I want to do a bigger investment in that. Whereas if you're just there for one day in a seminar, you don't get that continuity between and the breadth of information. The other piece is, I believe, what I have noticed, observed, and I only come in for the one day at the beginning, but I'm familiar with the different lecturers and really impressed with
The quality of the
quality
content.
of who's there and the diversity of the perspectives as well. But I'm also really impressed with the dynamic of this group. It's almost like in a leadership program where you start to bond with others, and creating a network like that is sort of challenging in today's world. It gives you a chance to network with people that you don't work with day to day. You can trust them. They've been through similar experiences, and you learn a lot about what challenges they're going through, what their career goals are. And it gives you sort of this confidant in a safe environment that you can bounce off. So it's automatic network that you can call upon, that it's not just someone you met one day that you might not feel like you could go back to, because you really do establish a relationship with these individuals over the time.
Yeah, we've heard that a lot too from past students. They felt very much appreciative of the fact that there were other folks in the healthcare industry facing some of the same challenges, and to hear their different approaches, in addition to the approaches of the experts that are coming in and advising on some of these things, to have that real world experience, not only from the instructors, but from your fellow students as well. So I'm seeing just Jeff commenting that this was very informative. I don't see any other questions coming in today. Please do follow up. If there is something that you are curious about, you would like a little bit more information, anything that we can do to help support your interest in this program. As we mentioned, it will start in March. We are accepting applications now, and you can find out more information at learn.uvm.edu. And again, if there's any questions, you can certainly use that chat box that we have on our website, or follow up email with questions specifically, and we'll get those to the right people. Kathleen, thank you so much for taking a few minutes out of your busy day to give us a perspective on this course, and Catherine, so much from your busy day joining us and continuing the vision of this course, and to help build our next round of healthcare managers and leaders. We really appreciate that.
Thank you for all you do. This is a wonderful program.
Great.
Happy to support.
Good, thank you. And hopefully we will see many of you in a few months. March is not too far, believe it or not. And so happy holidays to everyone, and hopefully we'll see you again. If you have any other questions, please let us know. We will send out this recording of the webinar following up in another week or so. Have a great afternoon.
Thank you, Nicole.